Friday to you, and thank you so much for tuning in to This Is the Day. I hope you're keeping safe and also ensuring that you are there to the measures of keeping safe. My name is Sarah Otieno, and we are live on This Is the Day, live on Family TV, also live on Family Radio, where the music does the talking. Now, as the world is battling and scientists are practicing, make sure they get a vaccine for this virus, the COVID-19 virus, we have different countries that are putting different measures in place and even coming up with their own vaccines. We'll be talking about that story a little bit later, but for now I want us to look at the global views and where we stand as the world right now. So as it is right now and currently this exact time, the corona cases in the world are 2,760,442, and the total deaths as it stands this particular moment is 193,148. We also have recovered cases, and it's always good to note that the recovered cases are higher than the death cases in the whole world, and the recovered cases are 762,784, up from the number that we shared yesterday with you. Now let us also look at the top countries when it comes to these cases. Which one are the top 4 countries? We'll start with the countries that have recorded the highest cases today, and we have Spain that has recorded 6,740 cases in the last 24 hours, standing at position 1. Then we have Russia with 5,849 cases. We also have UK that is following closely with 5,386 cases. And on the 4th position, we have the USA with 2,949 cases. Let us look at the deaths, because we also want to know which country is recording the highest deaths. So today we have the UK with the highest number of deaths, that is 768. We also have Spain with 367. We have Belgium with 189, and we also have the USA at a drop that is from yesterday. This day they have 134 new deaths that have been reported in the last 24 hours. Now let us look at it locally. And 16 more cases have tested positive of the coronavirus, raising the Kenya's total number of cases to 336. That is according to Dr. Rashid Aman, who is the Health Chief Administrative Secretary. And he told the press that the new patients were among the 946 that were tested in the 12 counties in the last 24 hours.
In the last 24 hours, we have tested 946 samples across 12 counties. This brings to 16,738 the total number of tests conducted so far. From these latest tests, 16 persons have tested positive for COVID-19 disease. We therefore now have a total of 336 confirmed cases in the country. These 16 positive were picked out from among communities by our surveillance teams.
Well, the new cases are now at 336. And on the issue of the push of a full reopening of the court, on this he said it is not yet time, and he thanked the judiciary for handling this matter. Above that, he also appealed to lawyers to consider the dangers that they're facing and we are all facing as a country.
We want to thank the judiciary through the Chief Justice Honorable David Maraga for exercising restraint in handling this matter. The health and safety of our court users comes first. Otherwise, there will be no one to dispense justice to. We further appeal to our lawyers to take into full consideration the enormity of the danger facing all of us. We are delighted that the lawyers have been good partners in these efforts, and we hope they will continue to support the country's containment efforts. We also want to thank the judiciary for supporting the fight against COVID-19 pandemic. We greatly appreciate yesterday's court decision that upheld the measures put in place by the government.
Well, the CAS also talked of the importance of healthy living, stating that people with non-communicable diseases are at more risk and should put these measures into discipline.
We emphasize the importance of healthy living. It is important to note that people with non-communicable diseases, such as heart diseases, hypertension, diabetes, cancer, chronic respiratory disorders, among other non-communicable diseases, are more susceptible to contracting COVID-19 disease. We urge persons with these conditions to follow all the precautionary measures for preventing COVID-19 with great discipline. Adopting a healthy lifestyle is important now more than ever before. Eating healthy diets with plenty of fruits and vegetables, keeping physically active, quitting smoking, limiting or avoiding alcohol intake, and getting enough sleep are key components of a healthy lifestyle.
Well, it's also important to note that sleep and enough sleep, as the CAS has pointed out, is an important aspect. Remember, the WhatsApp number that you can use to call us and always contact us from is 0786 316 316, SMS line 20316, on Facebook and Twitter at Family Radio 316. Now, when we look at the numbers of COVID-19, the positive cases continue to rise in the country, and one of the counties that is becoming into high focus is Mombasa County. Now, Mombasa continues to post high figures, with Governor Hassan Joho now claiming that the residents are breaking all the safety rules. The governor has also calling for a total lockdown for the region to curb the increase of COVID-19 cases.
Na hali vile iliovo sasa ni kugumu sana. Lazima muelewe ni kugumu sana. We are at a point ambaye kwa miji mengine inaitwa the point of community transmission. Yani hii corona iliyoko Mombasa sio tena ya kuletwa. Mutangoja paka lini ndio muelewe? Unangoja paka kuingilia nyumbani kwako. Some of the people unfortunately never believed kama corona iko. Paka walipopata familia zao ndo sasa wanaanza kusema kumbe ni reality. Let me tell you, iko na iko milangoni kwetu.
Well, Mombasa is one of the counties, and as we stand right now, it bears 25% of Kenya's COVID-19 burden. Now, even though the Nairobi County has maintained the lead with these cases, there is a 65% of all the reported cases that is in Nairobi, but Mombasa trends is infectious, and it's worrying the residents of that area. So as of today, out of the 336 cases that have been tested in the last 24 hours, we have 84 confirmed positive, and that is the total number of people who have been infected in Mombasa County. Now, 5 have been tested in the last 24 hours and have tested positive from Mombasa County. Now, why do we have Mombasa being in one of the epicenters of the COVID-19 virus? Let us first look at the trends.
From the samples collected today, we have 17 persons who have tested positive for coronavirus disease. This therefore brings the total of confirmed cases in the country to 320 cases. All the 7 are Kenyans, 12 from Mombasa.
Of these, 11 were in Nairobi and 5 in Mombasa. Mombasa's 5 cases are in Kiembeni 1, Sentikumi 1, Stadium 1, Msikiti Nuru 1, and Mulaloni 1.
As we continue with this fight, we have also observed that some public service vehicles are defying our containment measures. And increasingly, we are sliding back to the old ways of conducting business. We would like to remind Kenyans that action shall be taken against anyone known to be flouting the current containment measures in place.
Well, this is just a comparison of yesterday and today, the trends and the numbers in Mombasa County. Now, why Mombasa? That question again. Now, let us look at the Kenya Ports Authority, which has over 5,000 employees, and it has been identified as an epicenter of the infection in Mombasa. Now, at least 24 out of the 84 cases in Mombasa are workers of the port of Mombasa. Now, this authority, having lost 2 of its staff to COVID-19, they're now accounting to nearly 15% of the national death toll, standing at 14. Well, could it also be the culture of these people? Look at their living culture, their eating habits. Could this be one of the reasons as to why Governor Hassan Joho wants Mombasa County to be on a lockdown? Now, how does a lockdown look like? Let us help you understand how it looks like. And we are talking to Harrison Mungai, who is in Nigeria, where there is a total lockdown at the moment. Hello, Harrison.
Hi, Sarah. How are you?
I'm fine, thank you. How is Nigeria?
Nigeria is it's hot, and we trying to cope with the new normal of COVID-19 lockdown and all stuff. So crazy.
All right. So you guys are in lockdown, and in what state are you in right now?
Currently, my work has taken me to Ogun State. So it's would I say it's east of, or no, it's west of no, it's east of Lagos. Yeah, and so where I am, we have lockdown on every alternate day. So one day is complete total lockdown, then the following day you are allowed movement between 7 and 2. So today was one of those days where we allowed movement from 7 to 2.
So let me try to understand this. So let's say in Kenya, or I'm assuming the days of the week are the same even for Nigeria. So on Monday, if you're on total lockdown, then that means on Tuesday you are allowed movement.
Yeah, now like today being Friday, yesterday was total lockdown. So this week was Monday is open from 7 to 2. Tuesday is total lock, as in from 2 o'clock till Wednesday morning, you're on lockdown. And then from from Wednesday afternoon to Friday morning, you're also on lockdown. So we have 2 days of open, 3 days of open, and also now 4 days of closed.
All right. But this movement is also restricted with time, right?
Yes, it's restricted with time. So that's why they are saying you're allowed movement between 7 and 2 p.m., 7 a.m. to 2 p.m.
All right. And how is it being in a lockdown? Kindly just take me through the situation right now.
Sarah, lockdown is not something funny. It's different because one, for me, because I'm working, I'm forced to have all my stuff in my house.
Yes.
So it means I have to have internet connectivity, I have to have food, and I know that it has to be enough to cater for the days I'll be locked down. And also, you find that now movement is curtailed, so you can't really get out of your estate. And also, no people are allowed to come in. So you are actually restricted. Movement is restricted. If you're found out there, you could be in trouble. Yeah.
All right. What do you mean trouble? Sorry to ask. What do you mean you could be in trouble?
Okay. They arrest you, and if they arrest you, chances are you could either be paying fine or be taken to quarantine.
Wow, that is forceful quarantine.
Yes, because you're not listening. You're not obeying.
All right, sawa. So for how long do you think this lockdown situation is going to go on in Nigeria?
You see, we've been in this situation now for, it was, at first was 2 weeks, then it was extended, so now it's been 4 weeks. And chances are that rumor is that it could be extended by another 2 weeks.
Okay. So that makes it...
Those numbers have been going high. Right now we are at 981 cases as of yesterday night.
All right. So,
and 31 deaths. So definitely it's becoming more alarming by the day.
All right. So my thinking, if you compare the days previously when you did not have a lockdown and right now, and especially for you, like you are a working person, do you think this lockdown has affected you in a way?
Definitely it has, because psychologically you feel like you are actually boxed. You can't, you're only planning to work within the time that you're given. So the days that are open, you're feeling rushed. The days that you're locked, the days that you're on lockdown, you have a lot of time, so you have to plan yourself. So it's a mix of the two. One day you are running helter-skelter, another day you are around your space, but you have to do what you have to do. Because again, for us who are working, it's not holiday.
Yeah, sure.
So you have to remember you're waking up, you have meetings and you have reports, you have people to try and check how they're doing, how work is going. So work has to still continue. So it's a totally different setup and not the normal that we used to have,
All right. Well, thank you so much, Harrison, for sharing your experience in Nigeria. And we just wish for all the best right now.
Yeah, we are praying that this will actually change and we can be able to learn how to survive with COVID-19.
Yeah. Well, thank you so much. I'll let you go back to your meeting. But asante sana for sharing with us.
Thank you, Sarah.
All right. Bye.
Okay, bye.
Yes, that has been Harrison Mungai, a Kenyan living in Nigeria in the state of Ogun. And today, they had to be home by 2 p.m. for the lockdown. That is just one of the situation across the world where we have different countries on a total lockdown. So this is how things are. Is Mombasa ready for a lockdown? Maybe that would be the next question. So remember the numbers that you can use to contact us from on WhatsApp, 0786-316-316, SMS line 20316. Now let us head over to Murang'a. Now health experts in Meru County are now urging the national government to take stern action against the Governor Kiraitu Murungi, who held a public rally today with hundreds of attendants in which the county government dubbed a public awareness campaign. Now, they are now calling on the government to round up all of those who attended the rally and put them in mandatory quarantine.
Mkutano ule imewekwa na gavana wa Meru Kiraitu Murungi, amevunja sheria ya kafyo, ameweka mkutano zaidi ya watu 1,000. Kwa hivyo naomba serikali kuu na ule waziri wa afya Mutahi Kagwe, au watu watafutwe, wawekwe karantini mara moja. Kama si hivyo, watu hawataenda nyumbani saa 12 tena, kwa sababu wameanza kuvunjia sheria hapa Senji, na ni wakubwa wa serikali wamevunja wakiwa wameongozwa na Kiraitu Murungi.
Ninaambia Mheshimiwa Matiang'i na waziri Mutahi Kagwe, gavana wetu wa Meru County amevunja sheria, amekataa kunyizile sheria ya social distance.
Well, that is what happened in Meru, and right now they're calling on the government to take action. Now, as scientists are struggling to find a cure and a vaccine for the coronavirus pandemic, different people, and including our leaders, have different propositions and opinions on what can be done to cure this and tackle the virus. Now, Mike Sonko, the governor of Nairobi, has caused some concerns after he revealed that his COVID-19 relief package will not only include essential food items, but also a bottle of some alcoholic drink. Now, according to this governor, he implied that the drink may have medicinal properties, referring to it as the throat sanitizer.
I think it has created some mixed reactions. Why am I giving some small bottles of Hennessy in the food pack, the package which we give to our people? I think from the research which has been conducted by the World Health Organization and various health organizations, it has been revealed that alcohol plays a very major role in killing the coronavirus or any sort of virus. If you see, you take any sanitizer and you check the alcoholic content, you'll find out each sanitizer has above 70% of alcohol content. And you see those things we are putting there, that is not a drug or changa. That is Hennessy, which has some percentage of alcoholic content.
And Governor Mike Sonko is just one of the leaders that have this proposition in mind. And it's not only locally. Now, in Madagascar, that is, the President Andre Rajoelina has officially launched a local herbal remedy claiming that it prevents and cures the coronavirus. Now, this drink, which has been called the COVID Organics, is derived from a plant that has proven efficiency in malaria treatment and other indigenous herbs. He took it himself.
All trials and tests have been conducted, and its effectiveness in reducing the elimination of symptoms has been proven for the treatment of patients with COVID-19 in Madagascar. COVID Organics will be used in prophylaxis, that is, preventive measure. But clinical observations have shown a trend towards its effectiveness in curative measures as well. Other clinical studies are currently underway. So today I think that I'm convinced, in fact, that history will prove us right. But today there are already 2 cases that have been cured with the COVID Organics, but we'll actually see what happens next.
Well, we also have other African countries in the same boat. And now you might think it's only Madagascar. The DRC is still sailing in the same boat. Now the people of Kinshasa, that is the capital of Democratic Republic of Congo, have resorted to using the same traditional medicine to cure the coronavirus. So they flood traditional pharmacists at the Gambela Central Market to stock up what they call the Congo Bololo, believed to cure patients from the COVID-19 virus. Now, the African tradi practitioners believe that the way their ancestors might be the same way they will use to get out of the pandemic that has brought the global pandemic to its knees.
People with fever and cough are advised to take these plants: Congo Bolo, Lumba Lumba, Sisisimba, Sinki, the mixture of these plants, as we advise them to boil, then inhale and vapor for 3 days. After that, the patient will feel better.
We didn't prescribe Congo Bololo to people only for the coronavirus. No, Congo Bololo is a plant that everyone can consume. If they don't find a solution in modern medicine, they should return to the medicine of their ancestors.
Congo Bololo is a plant that everyone can consume. If they don't find a solution in modern medicine, they should return to the medicine of the ancestors. This plant should provide a cure for this virus.
Well, we've not only noticed that in Africa, even in the United States of America, the U.S. President Donald Trump has been attacked so much by the medical community after suggesting that research into whether coronavirus might be treated with the injection of disinfectant into the human body. Now, he also appeared to propose radiating patients' bodies with the UV lights, that is. And this is an idea that has been dismissed so much with this briefing.
Supposing we hit the body with a tremendous, whether it's ultraviolet or just very powerful light, and I think you said that hasn't been checked, but you're going to test it. And then I said, supposing you brought the light inside the body, which you can do either through the skin or in some other way. And I think you said you're going to test that too. Sounds interesting. Right, and then I see the disinfectant where it knocks it out in a minute, 1 minute. And is there a way we can do something like that by injection inside or almost a cleaning? Because you see it gets on the lungs and it does a tremendous number of the lungs, so it'd be interesting to check that. So that you're going to have to use medical doctors with, but it sounds interesting to me.
That was the U.S. President Donald Trump suggesting that sanitizers and disinfectants and also the use of UV lights can be used to deal with this pandemic. We already have Vincent Mulinge from Thika, who is saying instead of giving people alcohol to sanitize their throats, in quote, it could be better to increase the amount of food donations, then advise people to drink warm water. Thank you so much for your response, Vincent. You can also text us and give us your view on this story and any other story. The WhatsApp number is 0786 316 316, SMS line 20316. And as we do that, I will also be telling you about some countries that have started the human trial on finding a vaccine for coronavirus. Leave alone the trial and the hubs that we have some countries, and we have just been looking at some of the countries that are using that. Others have already started the human trial. There is Shisia from Embakasi who is texting in on the issue of using throat sanitizer, and he says, Sarah, we don't need throat sanitizer. We need wallet sanitizers. Pesa kwa mfuko. Thank you so much, Shisia from Embakasi, for tuning in today. Well, let us look at what the U.S. Secretary for State Mike Pompeo said, and he hit out on China again over the coronavirus outbreak and accusing it of taking advantage of this pandemic to bully its neighbors. He says China and the World Health Organization must be held accountable for the nasty campaign to deceive the world of COVID-19.
Where the WHO was unable to do its primary function, stopping a pandemic from spreading across the world. And this time they were unable to. You can see it. They said, don't close your borders. President Trump made the decision to do that and keep American people safe. They were too slow in declaring that this was something that could transmit from human to human. Those are the kind of things that the WHO has failed. The previous administration allowed China to walk all over us and gain trade, gain opportunities, create wealth and trade benefits for China. This president's taken fundamentally a 180 degrees different approach with respect to how we respond to the challenges that China presents to American security.
Well, now to some hopeful story here. Now, with the race of developing an effective vaccine against the coronavirus as it gains pace, clinical trials on human beings was approved in Germany. Now, German regulatory body by the name PEI greenlighted the country's first trial on human volunteers for a vaccine that was developed by the German firm by the name BioNTech and the U.S. giants with the name Pfizer. It will involve 510 volunteers who are aged between 18 and 55 years old. That is only in the first phase of this trial.
We've started the first clinical study in Germany for a vaccine approved by the Paul Ehrlich Institute. They're beginning with 200 subjects aged between 18 and 55 who will receive the vaccine. This is a good signal that the development of a vaccine in Germany has progressed enough to start the first studies. At the same time, the advice remains important. It will take months.
Well, this has also been happening in the UK. Now, in Britain, the volunteers in the first trial of the University of Oxford were given the first dose of the potential vaccine yesterday, and this was based on the virus that was found on chimpanzees. Now, though there are about 150 development projects worldwide, the German and the British plans are among the only 5 clinical trials on humans that have been approved across the globe, and this is what some of the volunteers had to say.
I think you can never fully exclude any sort of potential risk, but I think you have to, I guess, walk in faith in these things. You have to trust in that the work has been done as best they can, and know that the cause is important, and so you just have to just walk in faith in that.
Well, I'm a scientist, so of course I want to try and support science, the scientific process, whenever I can. And since I don't study viruses, I felt a bit useless these days, so I felt like this is a very easy way for me to support the cause. Yeah, that's why I'm here.
At the moment, our plan is to give 1 dose to people and to see the response to that and whether that is sufficient to provide protection. And it's certainly true that in older adults, generally those over 70, the immune response is much poorer to most vaccines. And so one of the reasons for doing the trials in that age group is to study that question. Do they need more than 1 dose?
Well, that is good news, and if these vaccines pass to the next level, then it is good news for the whole world, because yes, there is hope at the end of the tunnel.